I'm going over the 11 biggest causes of burning feet, aching feet, sore feet, itchy feet. So all this type of pain, if it keeps you up at night, if it bothers you during the day, we're going over it, including solutions, and we're starting now. There's a lot of different causes. Some of them are nerve diseases, some of them are skin issues. I'm gonna go over the stuff that I see most commonly, and then I'm gonna tie it all together with a big secret. So stick around to the end because it's very important. Number 11, toenail fungus. Your toenails are home to bacteria, to itching, to fungus. It's said that 10% of people in the United States, probably even more around the world in other countries, are affected. This can lead to itching, burning, aching. And the thing is, toenail fungus can go from your nails into your skin. So unless you clean up your nails at the same time, your skin's gonna itch. That can lead to athlete's foot, itching, sweating, burning, getting between your toes. So your toenail fungus is kind of like a reservoir for that burning and that itching. So get that cleaned up. I have full videos that go over all the home remedies, all the treatments, all the best products. So check that out. It's linked below in the show notes. Number 10 is alcoholic neuropathy. I see this a lot, very, very common. Peripheral neuropathy is said to affect between 2 and 8% of adults over 18. Alcoholic neuropathy is a big component. If you're drinking, over 1 or 2 glasses at a time, numerous times per week, then you're ripe for some of these symptoms. At nighttime, this could be numbness, burning, itching. Drinking alcohol, especially for men, can lower testosterone, mess up your hormones, just throw your body out of whack so your nerves are not working properly. Seeking treatment for alcohol, a lot of the times as you cut down on your alcohol and cut it out of your system altogether for a week, 2 weeks, 3 weeks, this can make a big difference. And on that note, that's kind of like eating sugar at the same time. Get rid of those sugary, garbagey foods, alcohol, cut it out of your system. See how you feel in like 2-3 weeks. That alone, for most of my patients, does the trick. So if you have that numbness, burning, and tingling, don't go for the expensive solutions. Just cut that stuff out. See how it does for 2-3 weeks. That can make a big, big difference. A study published in the Alcohol and Alcoholism Journal in 2016 said that if you have alcoholic neuropathy and you stop for a few weeks, most symptoms should go away unless you've been doing it for years and years. Number 9, medication side effects. So certain medications, especially number 1, chemotherapy drugs, antiretroviral medications can cause peripheral neuropathy. There's like 100 different causes of side effects from pills that can cause these issues. So I won't get into the specifics so I don't get knocked out by Big Pharma on this channel. Look at the side effects. Most of them will list it. So the real key for medications is getting as healthy as possible, getting to the root cause of your pain, your issues, the reason you're taking those drugs in the first place. That's where diet and eating healthy can come in handy. A lot of the times, being able to get off those medications can make a big, big difference. And I have my guides on how to do all that below. Makes a big difference. A study published in the Journal of Clinical Oncology in 2014 showed that people that go through chemotherapy, a very high percentage of them can develop these issues. And for long-term medication use, this can happen as well. Number 8, hypothyroidism. Your thyroid is up in your neck right here. Hypothyroidism occurs when the thyroid gland does not produce enough thyroid hormones. Treatment usually involves hormone replacement therapy with synthetic thyroid hormones. Realistically, if you're hypothyroid, you're gonna be tired, you're gonna be fatigued. Taking some replacement medication, I even have a doctor in our group that takes this. He says if he misses his dosages, he feels sleepy, his nerves can ache. So a study published in the Journal of Clinical Endocrinology in 2019 showed that levothyroxine therapy can eliminate these symptoms of hypothyroidism. Sometimes that can help with your peripheral neuropathy and numbness and burning as well. Number 7, diabetes, specifically type 2 diabetes. This can cause nerve damage called peripheral neuropathy, specifically diabetic peripheral neuropathy. So as your sugar level is high, then your feet, your fingers, your toes are gonna ache. That's related to your blood sugar. Medications can help. Cutting out and improving your diet can help as well. I have a lot of patients that are type 2 diabetics. Once their diet improves, once they start losing weight, their symptoms dramatically can improve. If you have a hemoglobin A1C of about 10, you're probably always going to have numb fingers, numb toes. And the tricky part is 80% of people in America are pre-diabetic and don't even know it. So that means your blood sugar is high, you're eating snacks, processed foods. Does that sound like you? Try cutting that stuff out. Try losing a little bit of the weight. Those fingers, those toes should gradually start to feel better. Get diagnosed by your primary care doctor or come see us in Michigan if you're in Michigan for your diabetes care. In the Journal of Diabetes Care, they found that a combination of therapies, including controlling your blood sugar, getting it down, provided effective relief in people with peripheral neuropathy. That can make a huge, huge difference. Get to the root cause, get that weight down, reverse that type 2 diabetes. It's possible in like 90% of people. We have great videos on exactly how to diagnose your diabetes, the top 30 skin conditions, everything. We go over all the diabetes, pre-diabetes guides and how to take care of it, including diet, down below. Number 6, restless leg syndrome. I see restless leg syndrome all the time. This is where your legs jitter, they're uncomfortable, they ache at night. Here's kind of the trick though, and I get bashed in the comments for this, but I stand by it 100%. Most of the patients that come see me with restless leg syndrome, and I wish I could have them here for a testimonial, what happens is they're diagnosed with restless leg syndrome, they're put on all the medications, their calves ache, their ankles ache, their feet ache, but really they get compression, they get sore muscles, they get aching. Once you get them in good shoes, good orthotics, massage their muscles, get pressure off there, magically their restless leg disappears. I would say in like 75% of cases or more that I see personally. Obviously that's not a research study. What happens is doing that, the soreness of the nerves, the aching, the muscle soreness comes down, those nerves aren't as stretched and swollen at nighttime, and that restless leg goes away. True restless leg is a nerve condition that does need medications, lifestyle modifications, better shoes, better orthotics. All that stuff can make a big difference. A study published in the Journal of Neurology showed that medications like pramipexole used for restless leg syndrome can be very effective in controlling its symptoms. So if you do those lifestyle changes, if you're stretching, getting strong, good shoes, good orthotics in the house and outside the house, if that's not doing it, then medication may be necessary. If your legs are bouncing around, sore, achy at night, and there's nothing you can do. Number 5, tinea pedis. This is also known as athlete's foot. So we talked about thick fungal toenails, but if you have thick, itchy, scaly skin, if you have white, flaky skin, this is an athlete's foot infection. It can cause itching, burning, redness. This can actually irritate the nerves and cause nerve pain at the same time. So this can cause burning, itching. I like to start with number 1. Soaks. So you can do soaks, apple cider vinegar soaks, there's Epsom salt soaks. This cleans off a lot of that dry skin. You can use a brush, a pumice stone, clean off that loose, flaky, dry skin. That's what fungus and bacteria love to live on. Newsflash, fungus and bacteria can't live on good, healthy skin where your immune system penetrates. They live on thick toenails, thick, flaky skin, all that loose stuff. You got to clean it up. Then you got to put something on your skin like a topical antifungal. I have a lot of great links, my full athlete's foot guides that show you exactly what to do down below. Sprays, creams, they all work well, but you gotta get rid of that loose, flaky skin. The Journal of Clinical Nursing in 2017 found that a topical antifungal treatment can be very effective, but here's the trick. You have to use it for over 4 weeks. If you use it for over 4 weeks, it's like 90+% successful. If you only use it for 2 weeks or less, it comes back like 50% of the time. Number 4, swollen feet and ankles. Swollen feet, swollen ankles, this is usually a biomechanical issue. It could be a heart issue, could be a liver or a kidney issue, but if your feet are swelling, that skin stretches those nerves. Those nerves now ache, they throb, especially at nighttime. They're aching, they're throbbing, it puts pressure on the skin. The skin can also get very thick. If you have lymphedema, that's chronic long-term swelling, the protein actually deposits in your skin. If your feet and legs are swollen a long time, it can turn brownish due to the iron from your red blood cells, or the skin can turn scaly and crusty due to your lymphedema not being able to absorb protein from your cells. You can have a tree bark-like effect. That could be a big problem. That could damage your nerves at the same time. A very high percentage of the population has swollen feet, swollen ankles. It's a big deal, but you can take care of it. Guess what? I have a guide, all the best supplements, all the best foods, all the best home remedies, all the treatments. Down below, check the related videos. I have guides on all this stuff. Check it out. You won't be sorry. I put a lot of effort into those guides. Number 3, peripheral artery disease. This is arteriosclerosis. So swelling is the blood flow can't get back up to your heart, but artery disease is your heart can't get the blood flow down to your feet. They're both kind of related, but what happens with peripheral arterial disease, that's like cholesterol buildup, plaque buildup. You could have narrowed arteries, blocked arteries. The single biggest thing in this case is the secret is you got to get some exercise. You got to get some strength training in. What happens is there's great medications, there's great exercises, there's great supplements, but the big thing is you got to start getting healthier. You got to start lowering your body weight. You got to start eating healthy. You have to start strength training. Strength training is my actual #1 solution for arterial disease. I also have a list of the top 15 supplements for your blood flow. These can make a big difference, and in severe cases, surgeries may need to be done, like an angioplasty. That's like a balloon that opens up your vessels and a stent gets put in. Come see your podiatrist or your primary care doctor for an evaluation. The Journal of American Medical Association showed that walking, for example, and strength training makes a huge difference and can reduce pain in people with artery disease. Number 2 in our countdown, vitamin deficiencies. Deficiencies in certain vitamins such as B12, B6 can lead to impairment. So what happens is I have a video, basically the top 15 nerve deficiencies and how to supplement them. Don't worry, you don't have to buy 15 different things. It's a simple, easy guide that you can do on a budget. I'm not trying to sell my own stuff here. I know a lot of YouTubers do that. That's not what I'm trying to do. I link to stuff that's scientifically proven and can work well. All that stuff linked below because these can be pretty long, involved videos, but I go over that and show the studies in detail. B12 is a big one, the B vitamins in general, but there's a lot of great treatments for these nerve problems. Journal of Neurology found that high-dose B12 supplements, if your blood levels are low, can almost instantly start reversing neuropathic pain, and a lot of these are well studied. And number 1, peripheral neuropathy. So we already talked about that, but basically what peripheral neuropathy is means that the nerves in your fingers, in your toes are not working well. Now here's the trick. Peripheral neuropathy affects both hands and both feet equally. If one foot's worse than the other, one hamstring or one butt, it's probably not purely peripheral neuropathy. And where the trick is, peripheral neuropathy can be due to diabetes, to alcohol, to medications, to chemotherapy. There is 100+ different causes. The #1 best thing you could do is get a doctor to properly diagnose it, find out exactly why you're getting it, and fix that cause. But number 2, things like supplements, medications, lifestyle modifications. There's so many treatments out there. In fact, I have a book that I put a ton of time into. I go over this in detail. I review pretty much all the treatments, and we call it the Dr. 80-20 guide because I focus on the 20% most things that give you 80%+ results. That's really the key in this case. Is you can get so bogged down by all these studies and treatments. You want to go for the most cost-effective treatments that actually get you results. You don't want to waste time with expensive surgical treatments as your first options or getting stuck in all these studies. We look at all the studies, we kind of rate them. We've made some guides because I see a ton of patients with these exact problems, and they give me real-time feedback. If I'm giving them an expensive option, they're going to come and try and fight me in the office. So I can't be doing that. I got to get you guys practical solutions that are evidence-based and proven. And that's what we got to do. That's how you take care of peripheral neuropathy, because there's so many great treatments. It's hard to make out which ones are the best option and which ones are a scam. And here's the big secret. The big secret is this. I saved this one because this one is part of all of them. Nerve compression. Have you ever heard of carpal tunnel? Like if you're typing on a computer, your fingers can get numb. This happens in your legs too. You can get nerve compression in your lower back, your glutes. You can get sciatica in your butt muscles. You can get tarsal tunnel in your ankle, Baxter's nerve in your heel, the bottom of your heel, Morton's neuroma in the ball of the foot. You can get toes that go numb. You can get your arch that goes numb. You can get impingements at all these places. I have guides for all of these specifically, but in my experience, even if you have peripheral neuropathy or diabetes or something uncorrectable like a nerve disease, focusing on nerve compression and these biomechanical issues can make all the difference in the world for a lot of people. So that's really the secret in this case. We have to get you walking straighter. We have to get you walking more comfortable. And guess what? I have great videos detailing all of these. I list them below. Make sure you check that out. These guides have been watched by millions of people, and I've been able to fine tune these guides to make it as productive as possible for you. So make sure you check that out. Guys, if that helped, click the like, click the subscribe, and check out some of these videos that I have listed here because they're good for you.